Good morning, everybody. I've been listening in and I'm very impressed with this uh, fourth and best day of our annual Sunshine State Seminar. So thank you for joining us. And, I was looking at the vision of COPD Breathe Strong on their website, and it reads, our vision is taking charge to breathe strong through daily connecting, engaging, and empowering by educating COPD community patients, caregivers, and clinicians. Isn't that exactly what you're doing here this morning? I'm so thankful that you guys have put this together. And I greatly appreciate Doctors Robinson, Manino, and Conard for volunteering their time to speak to you all. All the respiratory therapists that have logged in this morning to take part in this event, especially Bob Spakowiak, Dave Henry, and Mike Hess for putting this thing together. So it is a blessing to have each of our patients here this morning. And by my estimation, it looks like there's about 50 patients from around the country, which is very impressive. So you patients are the reason we do what we do. So thank you for being here and have a great rest of your morning.
Thank you, Tom, and thank you for co-hosting as our partner. And we'd also like to just point out this picture on the slide represents our last summit in 2019 when we were live with the Breathe Strong patients from the Oxygenarians of DeLand, Florida. So I just want to thank that group for keeping us going and giving us the legacy to build upon for this year. Our guest speakers are Dr. Keith Robinson, pulmonologist, medical director of Syneos Health, medical advisor of Breathe Strong, as well as a number of healthcare industry advisory boards. More importantly, a passionate clinician. Welcome, Dr. Robinson. Karen has shared her advice and patient perspective to both nonprofit national organizations such as the American Lung Association, the COPD Foundation, the U.S. COPD Coalition, American Cancer Society, and one of the leading patient advocates in Florida and America. Welcome, Karen.
Thank you, Bob.
If you think about shortness of breath and what happens, you feel breathless, you do less, your muscles weaken, you get more breathless, you feel depressed, you avoid activities that make you feel breathless. This circle continues to happen, and we're trying to get you to get off of this cycle and get onto a cycle of good health. Your lung health journey began that day. Karen, you want to share your story?
Sure. In 1991, I quit smoking. I was told I was getting emphysema. In 2001, I was sent to a pulmonologist because I was becoming very breathless, couldn't do housework, couldn't walk up the stairs, couldn't do much of anything. And after the 6-minute walk, which was torture, the pulmonologist said to me, "You have COPD." And I had no idea what that was. I was very upset. So I learned, though, I became very interested in finding out everything I could. I did a lot of research. And over the years, I went to pulmonary rehab, and I have become an advocate of, and so happy that there are now organizations that are helping patients to learn.
Karen, as far as all the things you've overcome during this journey, what do you think was one of the most important tools or resources that helped you make this transition over the years?
I would say pulmonary rehab and making up my mind that I was, my life may have changed, but it was not over, and that I had a choice. I could sit on the couch and wait to die, or I could do everything within my power to stay active and reach out and help others. I received help from a lot of other patients, and that was the most important thing. I think just knowing I wasn't alone, that's important too.
And quick review here, if you can breathe strong. Your lung health journey can be very challenging, and that's why we created the 7-step lung health action plan. Number one, you need to be breathing to start the day and breathing well. To do that, you need to have good nutrition. You need to sleep well and get a good night's sleep. You need to have a good exercise plan to help stay out of the hospital. And you also need to make sure that you're following your action plan and you have the right healthcare team. And you're really finding the right purpose for what's driving you. How did Karen stay committed to that plan over the years? The exercise is a main point. And I just wondered, Dr. Robinson, if you'd comment just quickly on the importance of exercise.
Absolutely. Good morning, everyone. I think, when we talk in pulmonary rehabilitation about an exercise plan and most specifically about making sure that patients continue to do the things that they require to keep themselves safe, I often like to make sure we've separated exercise from physical activity. We use them interchangeably in rehab, but specifically, they're not the same. So physical activity is a thing you have to do every day in order to get up and be active, clean your home, maybe do the yard work, go to the grocery store. But exercise is a planned behavior. You have to plan to do exercises. So you have to carve out that time during the day where you're specifically working on improving your exercise capacity. And so I think in pulmonary rehabilitation, our primary goal is to obviously get our patients more physically active. And that's oftentimes through an exercise plan, which is giving you what we would in a prescription. So a frequency of exercise, at least a dose, meaning how much you need to do, and then how often you have to do it in order to accomplish a goal. So the idea that your exercise plan is very much tied to how physically active you are is why pulmonary rehabilitation is such a strong way to learn how to get back out and be more active in life.
Thank you, Dr. Robinson. Dave, you want to address step 1 of the action plan?
Yes, when we look at the first step, we're talking about pursed lip breathing. This has become very important. What I find interesting is a lot of patients do it automatically. They don't even need taught it. But breathing through your nose for a couple counts and then blowing out through your lips, your pursed lips, and counting for at least that amount of time and possibly double that. You don't want to hold your breath. Don't breathe out too fast or you'll hyperventilate. So you continue to work on these things till they really are second nature to you. Karen, I think you have a story about flight without oxygen from Washington State to Florida. Want to briefly describe that?
Yes, I do. And that was pretty scary. I fly with portable oxygen, and I was visiting my sister and my brother. And on the way back, my POC quit working. It just wouldn't turn on. It wouldn't do anything. And I was already in the plane at, I don't know what the altitude was. And after I calmed myself down a little bit, I started pursed lip breathing. And that's the only way I got through that flight, was to just continuously do that and keep my fingers crossed that I didn't have to get up and walk to the restroom, because I would probably collapsed, but it does work. It's not something I would recommend anybody do. Make sure that your POC is in good working condition. And so anyway, yeah, it was scary, but I got through it. Thanks to pursed lip breathing.
Dr. Robinson, would you comment on the importance of pursed lip breathing from your perspective?
Absolutely. I think there are very few things that patients can front that are going to be essential to ensuring that their ventilation, the ability to get air in and out of the lung is efficient, aside from using their inhaled medications as prescribed. And I think pursed lip breathing really does allow for patients in the time of anxiety, at the time of preparing for exercise or any physical activity, to reset the volume of their lung so that they're able to take deep breaths and breathe more efficiently. But more importantly, pursed lip breathing can increase your ability to increase the length of time that oxygen that's inhaled into your lung can get into your blood system and circulate to all your working muscles and to your mind and your brain. And so I think pursed lip breathing has multiple physiologic benefits. And I think most importantly, relaxing way, especially at the time of anxiety or if you're feeling extremely short of breath, to calm yourself down, but also ensure that you're going to allow your lung to help you to breathe more efficiently at the time that you're having some distress.
Thank you, Dr. Robinson. In addition to pursed lip breathing, harmonicas with the COPD 360 program is a wonderful tool that patients around the country have found to be helpful. Other patients in Arizona, I understand, are using kazoos as other inexpensive ways to accomplish exercise in a productive way. And also the breather, an inspiratory exercise tool, has been found to help not only patients with lung disease, but pulmonary rehab and world-class athletes have discovered this resource to improve health and quality of life. Dr. Robinson, do you know of any other devices that will expand your lung capacity?
You know, we've used some devices in our offices, utilize these little devices that actually allow for vibration within the airway to mobilize secretions that can cause increased resistance. So mobilization of any amount of secretions within the airway will allow that resistance to come down so that you're able to, again, ventilate and oxygenate. It can be accomplished with, say, an acapella valve. And so there are lots of PEP valves out there that can allow patients to again, mobilize any secretions that are causing resistance within the airway and allow for them to breathe more comfortably.
Thank you, Dr. Robinson. Step 2 is cleaning up your kitchen to breathe strong. Nutrition. You want to make the most of every meal. Make breakfast your main meal. Eat a total of 6 small meals a day. Make meals that you like. Invite someone to eat with. Eat and chew slowly. Pause occasionally. Put utensils down between bites. Plan your next meal. Enjoy your meal as much as your dessert, and try to drink plenty of fluids throughout the day. But just importantly, over the right on this picture, you want to remove foods that either give you gas or aren't healthy or can mess up your lung volumes by getting extra gas and constraining your ability to take a deep breath. And that reminder also that caffeine can block your medications, and you want to consult with your doctor. Dave, you want to talk about step 3?
Sure. Step 3, the daily exercise we've talked about somewhat. Eat well, especially foods with magnesium and B complex vitamins. And thirdly, establish a sleep routine. Very important. We need to get the number of hours that are necessary for us to feel refreshed the next day. And if you miss it, you'll feel it. And fourthly, talk to your doctor about using oxygen therapy. Dr. Robinson, would you kind of talk about oxygen medications and sleep apnea a little bit?
Yeah, you know, I think oftentimes patients that have oxygen that they utilize at home at nighttime, during bedtime, and while they're sleeping, I'm hopeful that some folks are aware that you can have 2 problems with your breathing at night, one being the COPD, the other potentially being sleep apnea. And so if you're waking in the morning not feeling fully rested, if you're hearing from your significant other, your loved one, that you're snoring or you look like you're not breathing at portions of the evening while you're sleeping with your oxygen, I would recommend having a sleep study done. The whole idea is that in some patients with both disease problems, getting a CPAP machine, a little device to help you to oxygenate and ventilate and breathe for the sleep apnea, might oftentimes improve your quality of COPD, simply because you're going to be well rested. You're going to be able to ensure that your oxygen levels stay safe during the nighttime, and that oftentimes leads to a better and more active day once you get your sleep quality improved.
Dr. Robinson, our step 4 involves play, exercise, and start walking today. When you had your office-based pulmonary rehab programs, what are 3 keys that you found most useful with those fun stealth activities to keep people active and in charge for healthier living?
So I think, you know, we discussed as a planned behavior, and is that the plan should be easy. It should be something that's easy to incorporate into your daily routine. And so what we found was that fancy equipment, treadmills, bicycles, new steps, which I love, are great when you're inside of a facility, but not everybody has the opportunity to get to a real, I wouldn't say real, but a lab or even a hospital-based rehab center. But we learned that the same physical activity and exercise plan with, say, yoga or Tai Chi gives you the exact same benefits that we're able to find with placing patients up on a treadmill for walking or on a bicycle for bicycling. And so the idea is that when incorporating activities that are what we call stealth, meaning the things you didn't know were going to make you better, into your daily routine, allows for you not only to plan in, but they're enjoyable. I mean, I think most folks will find the breathing with yoga to be beneficial, as you can learn how to do some of the same breathing techniques that Karen's been discussing in helping yourself to relax. But Tai Chi, again, gives you some ability to get mobility, some flexibility. And again, the same degree of exercise can can be obtained with, say, Tai Chi and yoga that you would get with walking on a bike or using a new step, and they can be done at home. They can be done on the road if you're visiting family. And so it's something that's portable, meaning you take it with you. And so you don't have to buy fancy equipment in order to get yourself physically active and improve your exercise during the day.
Thank you, Dr. Robinson. Dave, let's address step number 5 as far as the action plan.
Very good. Think about these things: shortness of breath, difficulty completing daily activities. These are the symptoms that you will find yourself having, and you may have one plus. So you may have a lot of these things happening. More coughing, wheezing, mucus is thicker, have trouble sleeping, as we've been talking about, low-grade fever, and feels like I'm catching a cold. So all these things you need to pay attention to and really figure out what you're going to do with that. Dr. Robinson, can you give us 3 good steps to really taking care of a bad day?
Well, you obviously want to make sure that you're following your action plan. And this is something that you should set, I would say, day one with your pulmonary or your primary care physician, which is ensuring that you've taken all your long-acting inhaled medications up front, that you've assessed whether you're at least number of days that you're feeling ill, in regards to whether you need to seek help or assistance with your clinician. But you also want to make sure that you've assessed your oxygenation, make sure your oxygen levels are appropriate. If you've got a finger pulse, and then you want to have in that action plan what to do next if you're not feeling well, whether that's increasing or adding the nebulized medications that you're probably prescribed and using them at a frequency that's more often than what you had maybe the day prior. And if still not getting to a point where you're feeling much better, having part of your action plan suggest who to reach out to inform them that you're having some difficulty. What we generally try not to allow folks to do is to get into 2 days or 3 days of feeling down. So generally for me in my office specifically, we wanted our folks to tell us after 24 hours of using their action plan, whether they were improving or whether they were still sitting within a yellow in regards to their action plan. And certainly if they've reached the level of red, which is a cautionary part of their breathing concerns, that they know exactly where to go, who to call, and informing that they're having some distress that requires more intensive therapy, whether that's an antibiotic or steroid therapy or both. But hopefully we can keep you out of the hospital if your action plan is highly specific to how you're being managed by your treating physicians.
Thank you, Dr. Robinson. Dave, what about your healthcare team?
As you look at this slide, you're going to probably see many of the types of people you're going to interface with: primary care, nurse practitioner, pharmacist, dietitian, and then specifically your respiratory care team, pulmonologist, respiratory therapist, lung health navigator, psychiatrist, or psychologist. Dr. Robinson, what's the role of the patient in helping choose their team?
You know, I think the one thing that we should put in the center of this slide is actually the patient. You know, the patient is a captain of all things. They drive the ship. And so I think while it's wonderful to have a great working relationship with everybody that you see listed here on the screen, but, you know, I think the whole idea behind self-management is that we empower patients to know that they're the reason all these people exist on the screen to have a job to do. And so, you know, you're front and center. You're the reason why I think many of these clinicians that you're meeting with should be interactive with you, that they should specifically make a plan that's highly individualized towards what your needs are. But more importantly, they should all remember that you're the one that's in charge. You're the person that the reason that they're all involved in your care has everything to do with you and empowering you to make sure that you're getting what you require. And so I think as a captain, you're going to have to mandate and dictate, which is tell folks what you require, tell them what's not working, and feel confident that in doing so, these folks are going to do the best they can to give you and provide you what you need in order to get that ship going in the right direction.
Thanks. Bob, you've experienced some things personally. Can you comment on your situation according to what Dr. Robinson has suggested?
I'd be glad to, Dave. I always felt like as a respiratory therapist, I had difficulty sometimes identifying with the needs of a lung health patient until the past year. I have gone from a diabetic patient that could sort of relate to COPD to having a major heart attack, major cardiac surgery last summer, several months later, having symptoms of shortness of breath that I couldn't identify. We attributed it to the cardiology problems, but it ended up, because I made the decision that Dr. Robinson just said, to empower yourself, I had to make a decision to switch cardiologist. And that cardiologist found something on my chest that saved my life, because now, although I have lung cancer and malignant melanoma, I'm on the course to recovery, because that second doctor, who I didn't feel comfortable with the first one, directed me in the right direction. And I'm just very thankful that empowerment, but it's the most important point. And thank you for asking. And I'm a lung health advocate, but I'm a different lung health patient now. I have shortness of breath, but it's not COPD. It's the lung cancer, but it's getting much better as the immunotherapy is taking its course. Thank you for allowing me to share my story.
Thanks, Bob. Karen, did you ever have to make a decision in relation to your care team? Can you share about that?
I had to make a decision about the pulmonary rehab that I went to. The first one I attended was not helpful at all. She was married to a young man who had gone to high school with my son. So it was, kind of old, whatever. It was not pulmonary rehab. And then a couple, 3 years later, my pulmonologist said, "You've got to go to pulmonary rehab." I said no. He said yes. There's a different facility, and I went, and it was the best thing I ever did. But I've been very fortunate in having good primary care physicians, wonderful pulmonologists. I moved 6 years ago. I was concerned about finding the same level of care here that I had had in my former location. And luckily I did. I found wonderful care. And luckily I went to pulmonary rehab the second time. It was the best thing I ever did.
Thanks, Karen.
Karen, thank you.
Bob, is purpose, step 7 purpose. Can you cover that with us?
Sure, Dave, thank you. Number 7 is probably one of the most important grounding points, and that is, without purpose, life is empty, short-lived existence. The why behind everything we do, having a reason for living. Let go of being a knower of 1% that you know. Embrace living as a learner of the 99% you don't know. Mark Batterson, an author who speaks much about this issue, wrote, "I'm not convinced that your date of death is the date carved on your tombstone. Most people die long before that. We start dying when we have nothing worth living for. And we don't really start living until we find something worth dying for. Ironically, discovering something worth dying for is what makes it worth living."
Thanks, Bob. Thinking about everything we've talked about here, the takeaways, think about these key points. Learn to breathe, get the right nutrition, sleep well, learn to exercise and play again. Follow your life action plan, very important. Find your proper health team. Breathe, eat, sleep, play, plan your team. Laugh whenever you can. Very important part of what we need to do as far as our attitudes. We really appreciate Breathe Strong America, and special thanks to Florida Society for Respiratory Care and the Patient Summit. If you can breathe, you can breathe stronger. Please visit us at breathestrongamerica.org, and you can really learn a lot more about what we've talked about here. Thank you very
And I'd
much.
like to thank Dr. Robinson and Karen Deidemeyer and Dave Henry for this session. Thank you.
Thank you.
Thank you.